and of course Nita and Ushma. You all are present here. And the first interrogation to all of us is from Dr. Manish, and he will start the ball rolling.
So, good afternoon. We want to explain the thing which is unexplained. My first question to all of you, just think, unexplained infertility, it is boon or curse to whom? Yes,
Doctor.
For the doctor, it is the challenge. Because
it is the challenge. So, it is a curse to the doctor.
It is a challenge.
It is a challenge. Diksha?
But it can be tackleable.
Okay.
It can tackle.
Yes, madam.
Challenge for both.
Challenge for both. Yes, madam. If we say for a gynecologist, it is just little bit of good. If you find or type unexplained infertility on the Google, you will find more than 136,213 pages. So it is good for us that things we want to explain which is naturally unexplained. And today with me and sir, we are going to explain the thing which is not explainable. So for us, it is a rule that if you don't able to do anything, you can say it is unexplained. And for patient say everything is fine, even though I have not become pregnant. So it is a curse to the patient. So what by you as a definition of unexplained infertility and what is the incidence? Yes, madam.
So unexplained infertility as per SJ is defined as a condition in which there is infertility below the age of 40 in females where there are no describable anatomical factors, uterine, ovulatory, tubal or pelvic factors with a regular sexual intercourse in a partner whose husband's semen analysis.
So madam, why not make the cutoff 40? Why not 35? Age? Is there any specific definition? Why want to continue up to 35 or end of 40?
The ICMAD guidelines initially told that infertility is defined as absence of pregnancy after 12 years of unprotected intercourse.
12 months.
12 months. When the age of the wife is less than 40 years. This is purely, as Father was with ICMAD committee, this is purely a Caucasian age study.
Yes, it is not the Indian age.
The age cutoff should be quite less comparatively. But after 40, we know that ovulatory issues will be higher. So it is better to have a larger cutoff than a lower cutoff. But this time the SJ committee added of regular coital frequency, which was not there previously. Because this is a big challenge in today's day and time.
Because nowadays corporate people, they don't have time. They have got more time for the meeting to the other people rather than meeting with our own wife.
6 महीने day 10 और day 11 पे try किया, पर नहीं हुआ ऐसे
Thank you.
And one more thing, that inside quality and the ovarian reserve, which we don't take into account in the definition, reduces after 40. So after 40, we cannot say it is unexplained.
So, and her husband for coming to a conclusion that they have unexplained infertility. But what exactly do you mean by thorough evaluation?
The ovarian reserve testing, the tubal testing, the semen analysis. Also, ICMAD mentions that the male should have a normal genitourinary anatomy. The testicular function should be normal. So these are the constituents mainly. Also, the uterine cavity should be assessed.
Ovarian reserve is as such not included in the definition. We do not require AMH and FSH level or even AFC for unexplained infertility. So apparently normal ovulation cycle should be ovulatory, normal semen analysis parameter, at least one patent tube and normal uterus. These are the
So we are expecting everything is normal in this patient, even though she is not becoming pregnant for at least 12 months. Would you like to include 15,000 test battery just applied by Rishikesh Pai? 15,000 rupees battery of test.
No.
I only want to say only one thing, that about 20 years ago, ovarian reserve was never tested initially. So all the factors now have a time factor. That initially we were testing something else, now we are testing something else, and maybe after 20 years, MSD will be included in this. So the incidence of unexplained infertility will be less and less and less and less with the passage of time. Isn't it?
The more we investigate, we may find more reasons.
In clinical history, we have to evaluate the age and frequency of the coitus.
Yes, madam. That is definitely. But now, sir has rightly mentioned, and after the Rishikesh talk, we can say that we can explain the thing which is unexplained into the embryo culture dish. We are taking the cell-free DNA from this embryo culture without doing biopsy. We can explain the things which can be unexplained in her future pregnancy.
Sir, they don't include ovarian reserve testing because low ovarian reserve does not mean they are not able to get pregnant.
Yeah.
But it is always included in a GPP, the good practice guideline, at the end of
But
the
not in the
workshop that you should evaluate.
You're so right, Dr. Pankaj. But I think ovarian reserve testing will guide us as to expedition of the management, and that is why it is being tested.
Hence, it is in a good practice.
GDP guidelines, good practice guidelines.
So, I think this is okay. So, I feel that a woman comes to us and they have infertility. What impact does she have? What impact do they have on their family life, on their individual lives, etc.? Can you tell us what impact does it have?
So we can diagnose that if somebody coming with 4 or 5 different types of gynecologists, then we can say they are not able to explain, so I am also not able to explain to her, and that's why it's become unexplainable infertility. But she suffers so lots of psychological tests, emotional tests, and whenever she goes there, after 1 year, it is, બચ્ચા થયા ક્યારે સારા સમાચાર આપો છો મને કાકો ક્યારે બનાવો છો મને માસી ક્યારે બનાવો છો ફેમિલી પ્રેશર.
And have you talked to a patient who has been just told that the patient has cancer? The sequence of the feeling is first anger, then guilt. I must have done something wrong in my life, and that's why I have cancer. Then becomes sad, becomes depressed, becomes very anxious, and then there is loss of self-confidence and even self-esteem, and that is the sequence of events. Even an infertile woman or infertile couple feel when they are told that everything is right but you still cannot have a baby. They go from one room to the other, and the continuous thought of not having a baby is hampering their attitude, hampering their behavior. Right? So we have to be really taking care of a woman in this aspect. It is not just financial. Yes, please.
Sir, ESHRE 2023 has emphasized on the importance of psychological counseling in a couple of explained.
Absolutely.
So there should definitely be counseling.
There are patients who have got suicidal tendency after unexplained infertility, and there are the patients who are going for the Maharaj and Sadhus to become pregnant, and they are taking advantage because even though doing without anything, 1 to 3% of couple with unexplained infertility can conceive. So always tackle them with tender, loving care.
So we have been seeing that this is unexplained, and we have to treat this unexplained. And how can we treat the unexplained infertility? Only when we have some possible guideway. And how do we try to start doing it? How do we start doing or investigating these women? How do we start managing these patients? Can you guide us into that?
Yes,
Yeah, though we can explain the couple that the basic tests are normal, but there are many more things other than just.
Start from the basics.
Yeah. So
we have to go for the etiology stepwise.
yeah. So for once ovulation, tubal patency, uterus, and the tubes are checked, we can go for ultrasound to find minor
Can you
fibroids.
do something in history?
Can you dig out?
Yeah, starting from sexual intercourse history, menstrual history, past history, like previous past history of tuberculosis or.
So always give the years, listen them carefully,
Yeah.
because as the definition
So
of history says, study of past in light of present to have good future. Patients came to you to have something good future, to listen them carefully, dig out the cause.
Active married life, history of dismarriage,
Yeah.
things which can
It
be
should
taken.
not go like Gita, that after completion of Gita, Arjun said, मैंने कुछ सुना ही नहीं.
Past history of surgical, any surgical.
Any surgical intervention? Yes,
So
ma'am.
though laparoscopy is not
Habit reductions, because nowadays we have to ask it more frequently. Because just I mentioned in my presentation that previously we don't want to ask the history of smoking alcohol and weeds. Now we have to ask how many cigarettes you are smoking. So it's a common vices. Usually it comes with wife or without wife, but now it is coming before the wife also.
And so much about the history. What about the investigation? Simple investigation.
We can start with a good ultrasound, 2D, and if we have a facility of 3D ultrasound, 3D ultrasound might pick up some extra abnormality in the uterus or in the neck sac. We should never forget to do a post speculum examination, vaginal
Yes, it's a very
infection,
good.
cervical infection.
So many times we
Most
quote
of
that
the
there is
times
a
it is-
perforated hymen and she is the cause of unexplained infertility.
So after history, good PSPV examination might give us some clue. Then ultrasound, and maybe we can add laparoscopy if we are suspecting peritoneal disease or peritubal aggression or mild endometriosis. This can be picked up on laparoscopy.
I think that when
Yes.
we already diagnosed her as unexplained, we have already finished all this. So we have already done a good scan, we have already checked patency of the tubes, we have already done a semen analysis. So all these aspects are already ruled out. Now it's only how
So we can
soon
explain
you get her
whether the
pregnant.
fertilization
So
and
the relevant test I think is a thyroid test which is not given.
If suppose patient comes to you with all the battery of tests, now as an expert would you like to do something more?
I mean, I always believe that the patient has come to you for pregnancy and not
Yeah.
for treatment. They don't mind what you do, they just want a pregnancy. So it does not make sense to keep on wasting more time to do even more tests. It is better to go ahead with treatments, especially when the age is more and the duration of active married life is 3, 4, 5 years. I mean, जो भी cause था, it should have been ruled out by now. Now you should focus on how to correct these causes or give her a pregnancy.
If investigation is too much old, then we will repeat at least baseline,
Okay.
like AMH, thyroid and prolactin.
Okay.
And according to the history, if suppose the weight gain is so much, then we have to also rule out for the pre-diabetic condition also, developing things.
Would you like to test her for endometrial receptivity or anti-sperm antibody or some celiac disease?
No, fresh HSA with DFI is must. We are doing routinely in
Okay.
repeated negative history.
Relative negative.
Means suppose letrozole is given and not conceiving, then you have to rule out. And follicular monitoring is must. When the follicle is recruited along with endometrial corresponding is there or not. Fast growing follicle or early rupture.
Okay.
It is give the clinical clue.
So would you like to go
Because
for
papers are
perifollicular
normal.
flow also?
Yes,
If
papers
you
are
see there is
normal.
more than 100% perifollicular flow with good
No,
vascularity.
3D is not required.
No,
Only
no,
2D.
3D.
Yes.
I am not talking about 3D. I
Yes.
am just 2D with
2D,
very good
with-
perifollicular flow on
Timely rupture
ultrasound.
with timely progesterogenic effect. It is the clinical clue.
Okay.
Endometritis has to be ruled out in unexplained infertility.
How do you like to rule out
We can do hysteroscopy, immunological testing of the endometrial sample.
Endometritis, why would you go for hysteroscopy? It can be done with simple
Biopsy.
PCR test. Biopsy
PCR.
test, you can do pipette
CDM
test, you can take the endometrium and you
Yes.
can do DNA amplification.
Yes.
So, hysteroscopy is little bit invasive. So better if you are suspecting any clinical sign if she has got endometritis.
On hysteroscopy,
No, just simple clinical. You just use your fingers. Discharge for vagina. There is this pneumonia. There is this tenderness.
Tenderness and deep pelvic examination, tender uterus.
And she will complain that at the time of menses her tummy is little bit increased. Bloating. Sir, मेरा पेट बढ़ जाता है. Do you think clinically they have got endometritis? Okay, we are moving ahead, sir.
Now, you said that patient you are deep into IVF practice, and a patient with unexplained infertility has come to you, and you advise her IVF. And can you now, in during practice of IVF, can you now tell us or tell her that you could have become pregnant if we had done this? So can IVF become itself a diagnostic test? There are certain sequence of events during IVF that you would observe that will make you think that the woman really had this.
If the patient is 28, needed IVF, she got pregnant in the first cycle, it can be the cause of pupil function also. It can be pregnant but not functionally good. So these are many aspects which we are assuming we'll never be able to show.
Sure, there is any difference between IVF in unexplained and IVF in explainable, that is a tubal cause. Is there any difference?
There is IVF should be based on the ovarian result.
No.
Yes.
I'm just talking about if you are doing IVF in a patient with tubal damage and if you are doing IVF in unexplained infertility. Is there any result difference?
Yes.
Fertilization
is
defects.
higher in tubal factor as compared to IVF and unexplained infertility.
So
Because in
fertilization
unexplained
defects.
infertility we have got lots of M2, but they all M2 cannot go for
Whose
that.
side-
Fertilization defects.
Fertilization
There are so many cases in which your embryologist tells you that yes, you have excellent, say 15 M2s, and he does exceed. And on day 2 or day 3, he reviews them. And he'll say, sir, you have only 2 fertilizers in the clinical stage. And that could be the real reason. There will be very
This is
subtle.
also seen in tubal factors also and male factors.
But we are talking about
statistically,
Or there may be total fertilization.
But in tubal factor we don't have that much of difficulty because we have got something explainable. Here there may be the endometrial receptivity, there may be no good formation of alpha beta 3 integrins, there is no good formation of pinocchio, there is no good formation of anchoring agent, there is no formation of osteopontin that is available at the time of implantation. The uterine endometrium is not that much receptive in unexplained infertility compared to the tubal factor. And that literature says that if you have got unexplained infertility and if you are going for IVF, you have got little bit less result compared to explainable causes. Am I right? Everybody agrees except John?
Yes.
Because you are doing IVF in each and every patient and they have more than 80% success rate.
Now, I have
This is
given
the
you a
situation.
table. Here, please study this table. And this is the pregnancy per rate for treatment after treatment of unexplained infertility. Now, can you explain how you should go to a fresh patient who has been suspected to have unexplained infertility?
Sir, unexplained infertility, we
How will
should.
you proceed?
I will proceed in particular patient. The age is around 32. Her BMI is 31. She had came with 8 different doctors file with you, and you have got this much of data with you. So
Married for
married
3.2 years.
3.2 years.
32, 3.2 years. Now tell me.
Now tell me.
In unexplained infertility, we should aim at a multifollicular
Very
development,
good.
sir. Because we don't know the cause. So we should turn towards the gonadotropins a bit early for the management. Because it is said that multifollicular development will correct the subtle ovulation defects which are there in unexplained
Only
infertility.
gonadotropin or gonadotropin combined with some another things.
It can be combined, which will reduce the requirement for gonadotropins and it will, with IUI, definitely with IUI.
Much before you start therapy, will you do her something? She is 32 BMI.
Weight reduction, lifestyle modification
Yes.
should be counseled to her.
Because she might have got all the treatment because I told you there is a 8 different files. So everybody had tried differently. Now you have to sit with her, you have to explain to her.
She
Again, give thou ears, listen them carefully.
she cannot even afford gonadotropins at this moment. So then what will you do?
Lifestyle modification.
Lifestyle modification, even reduction of little bit of BMI, even 5% will give us very good chance of ovulation because it is unexplained. Obesity might be the cause. Okay, then
So
you could-
after lifestyle and giving the chance for expectant management, I would go straight away with stimulated cycle with IUI because
Okay.
in case of unexplained infertility, just ovulation induction with timed intercourse or just IUI without ovarian stimulation has a success rate of same as of expectant management. So I'll jump directly to the ovulation induction combined with IUI around 3 cycles, and if she does not conceive with the oral ovulation plus gonadotropin with IUI in 3 cycles, I would advise her to go for IUI.
But suppose this woman was not 32 and 38. She is now 38. What will you do?
In that case, IVF directly is certainly a better option.
So looking at all the parameters, of course we have to test the treatment and treatment should be tailor-made. It should be individualized.
Yes. But will you keep on giving her clomiphene citrate or will you keep on doing IUIs for how long?
No, max 3.
Maximum 3 in unexplained.
Unexplained.
3 to 6 around depends upon the cycle. You have to change the ovulation inducing drugs. You can combine the ovulation inducing drugs, and you have rightly mentioned you can combine with gonadotropin and give them the base result.
So expectant management. Expectant management is for young women,
No
no bilateral pubertal disease, normal EMC, and no seminal problems, no sperm problems.
Oh, very good endometrial cavity, everything is fine. Then, yes, ma'am. आप मेरे पीछे आके तो दिखते नहीं हैं। One.
Initially, I will go at the time in the first 10 days I can say IUI.
So 3 and 3, 6 cycles she wants to go for clomiphene citrate and 3 cycle of IUI. Nupur?
I'll straight away go with, as I said, ovarian stimulation with IUI because as she already tried expectant management. I mean, she has already.
If somebody has already done IUI, I won't go into the IUI. Somebody has already given clomiphene and tetrazoles, I have to become a one step
then
ahead.
exactly. I won't repeat the same treatment which has not worked.
अदरवाइज पेशेंट ये तो सर मैंने ली थी गोली ऐसी 5 गोली आगे वाले डॉक्टर ने भी दी थी तब 5 लोग या 10 लोग
So these patients are always in hurry. So rather than wasting time in the fertility treatment which has very low success rate.
now patient is in too much hurry, she wants to fly out, then
Yeah, we can give her option of IVF.
with IVF with same result is again the same result, or you have to say that because you have got unexplained infertility,
Yeah, result.
everything is fine, there may be little bit less chances that you become successful in first trial,
Yes, we need to explain that.
so you have to counsel them.
I think that one very important aspect here is duration of active marriage life.
Okay.
Young patient, but ranking 7 years, then it does not make sense to
7 years
expect
patient may not be young yet, sir.
Sir, 22 years, especially 28. We see such patients, I mean, very active coital frequency. Then
Even though they are not able to fertile,
Even
very
though
good
they-
fertility practice, but even they are not fertile,
Not
so
fertile.
it is one of the cause of unexplained fertility.
So even to reduce the time interval for pregnancy, we may straightway go for IVF.
So we were talking about expectant management.
Yeah.
This lady came to me.
Hmm.
She was 33 years, a corporate woman. She was a financial advisor to some big corporate. And while she was talking to us, she opened her purse and wanted to show me her previous prescriptions. And suddenly she drops a pack of cigarettes from her purse. And I was talking to her. And then she is slightly plump also. And she was in the habit of being a corporate lady. She was in the habit of going to the parties and probably 3 or 4 times.
Sir, it is known as social alcoholism.
Yeah, so she had probably every evening she would like to have a glass of wine and probably maybe a little stronger alcohol at the same time. So what would you advise her in the first place?
We should advise a smart goal for the woman, which is
Okay.
specific, measurable, approachable, reliable, timely. We can't just tell her to go lose weight and come. It is a slow process. She should be counseled for the same lifestyle modification. She should change her if any addictions like smoking and alcohol is there. She should reduce it. Try to reduce it. And yes, sir.
So how much alcohol can she take? She has to take.
It depends on the type of alcohol she is taking and.
Acha, okay, so you want to dig into deep. Which variety of she is drinking the alcohol same Sridevi is drinking, or she is taking 100 pack or 100 pack plus.
And the amount, the type and the amount of alcohol.
So suppose she is taking alcohol and now she comes to you with, she has got 1 packet of cigarette and 2 packs of alcohol every day. So would you like to directly go with IVF with this patient? She said, I got lots of money now, I don't want to become
She
pregnant.
has to reduce the habits.
Now she goes to Dr. Joel Benthal and Joel says, then I will do IVF. Okay, so if after IVF she conceives, this alcohol and smoking has got some detrimental effect on the implantation as well as in the embryo development.
Yes,
So no
absolutely.
level of alcohol or smoking is good. So ideal should be to
So
stop.
there is nothing like permittable limit
There
of
is no
smoking and alcohol.
permittable limit. There is no
Even though Gujarat government is giving the permit, but there is no permittable limit of smoking and alcohol if she wants to become pregnant.
It is easier said than done. I mean, तो आज फाइल में सबने यही बोला होगा उसको.
So
It is a very difficult.
So the consensus is that lifestyle modification not only help in routine management but also in IVF.
Before going for
And
IVF,
even for
we need to-
pregnancy assisted IVF, right? So that is a must. She must reduce her BMI. She must stop her smoking. She must reduce her alcohol intake. She must reduce her caffeine intake. Is that
So
so?
if you want to increase our chances of success getting this type of patient, rather than submitting to the patient, we have to submit that patient should listen us. She should follow the carry. We may lose one patient, but we may not lose the patient to become pregnant with their own habits.
सर
So-
स्पाउस के बारे में तो पूछा ही नहीं हमने.
इसके बारे में?
स्पाउस मेल
Spouse के
फैक्टर.
बारे में, yes.
High factor.
The spouse also has to reduce weight. Spouse also has to stop smoking. Spouse also, if he is a rickshaw driver, he has to come and.
I mean, that's why we told previously we don't ask that type of history to male. Now we have to ask history in a separate segment, like how many cigarettes, how many times you are drinking. Previously that section we are not attending at all. So spouse is, yes madam. Yes madam, take the
In
mic.
the history taking,
Hmm.
you have to ask about the history of tuberculosis to
Yeah.
yourself, to your family, to friends, related, આજુબાજુ પાડોશી સંબંધી કોઈ નહીં છે કે with whom you are in contact. This is the most important thing. I have diagnosed many patients of tuberculosis and they come with amenorrhea also.
Yeah.
Tuberculosis.
Amenorrhea, scanty periods, I bet
So this is the major thing. History taking, it is a very important thing, not that all the big investigations,
No.
you are not advised at all. Unless you do a basic preliminary investigation, history taking, that is very, very important.
That's why we are coming with the low cost management man. There is no 15,000 veterinary test. There is no big test in unexplained infertility. Sir, low cost. Yes ma'am, agree with you.
So thankful for your inputs. So you were talking about IUI. You also talked about chlomipene citrate. So what does IUI really do?
Many times fertilization
What
is.
does IUI exactly do to improve your fertility?
Yeah, IU,
bypassing the
sperm has to
cervical
travel lesser distance, so fertilization chances we are improving the chances of fertilization by keeping the motile sperm directly into the uterine cavity.
So life is like a race. If you are putting in the posterior fornix, you have to travel from posterior fornix into the cavity, from the intramural part to meet the beautiful ovum resting in the garden of Hampura. Now you are putting directly sperm at the door.
And
So
when
all
you-
the fastest sperm will go and meet the beautiful ovum. So you are bypassing all the things, and here in IUI we are taking the very good sperms.
And
Yes.
many times if the semen parameters are at the lower reference limit, doing an IUI
The
will
PMC,
always-
total motile count will be increased. So we are all bypassing the things, directly putting sperm into there, and that may be, sometimes there is a cervical factor, sometimes the endometrial factor, endometritis, yes sir.
And you also talked about chlomipene citrate or minor ovulation induction agents.
Yeah.
What does that do, Joel?
So the aim is to produce more than one follicle and place a bolus of motile sperms to as close to the eggs as possible around the time of ovulation.
Because of chlomipene citrate, there are something hurdles at the level of cervical mucus.
Cervical
As well
factors
as
are
the
automatically
endometrium.
gone.
So we are also bypassing these two things and make her pregnant, because sometimes cervical mucus is hostile. So it doesn't allow sperm to penetrate from the posterior fornix. So by doing IUI, we are putting that, we are surpassing these two factors also.
One
So
to
with
two
there is
X.
a low cost management with chlomipene citrate and IUI. It may be little bit explainable thing to make her unexplained infertility, to make her parental.
And also sometimes or quite often, chlomipene citrate does not give monofollicular growth. Sometimes you have multiple follicles, maybe two of them are very good. So a sperm has a choice for to have two ova, and whatever is the best ovum, that will get fertilized and that will get implanted. So what we are doing in IUI is we are selecting morphologically good motile sperms and without the seminal contaminants into the high area of the endometrial cavity, so that the sperm has to travel little less, the capillary region of the fallopian tube, and the fertilization becomes easier. That is the real principle of minor ovulation induction and IUI, and above all, we are all achieving this at a very low cost and very little monitoring.
So more energy is saved when sperm goes to the ovum.
So
This is the
fallopian cycle. Now just look at the data. The second line. In 1998, 45 published reports of treatment of unexplained infertility reported pregnancy rate of 5.6 as compared to 1.3 with no treatment. But just 12 years later, Cochrane database tells us that if you give only clomiphene alone, it is no good. Okay? So, SRN told us not to do that, not to give only clomiphene. Okay? If you are really going to give clomiphene, then you have to do IUI. And he rightly said that why this happens? Because clomiphene is detrimental to the cervical mucus quality and even some amount of endometrial receptivity. And that is why you should give paired clomiphene citrate with IUI. So
this is a low cost measure and it is very good. One concession should be there that if there is unexplained infertility, use the combined treatment, clomiphene citrate, ovulation monitoring, trigger, and then go for IUI.
So, to avoid these two complications, people have started using aromatase
inhibitor.
Okay, so how does aromatase inhibitor work? How do they work? Can you tell me?
Madam. Letrozole, it is an aromatase inhibitor. How it works? It is a monofollicular growth, madam. Mechanism of action. Okay, summary. Yes.
It is an aromatase inhibitor.
Okay.
It will increase the intra-ovarian androgens.
Okay.
Because it will inhibit the
Fantastic,
conversion.
madam.
So
And you heard that in between sometimes letrozole was banned.
Yes, sir.
What was the basic cause of that letrozole ban?
congenital anomalies and liver. I think.
No.
Yeah.
Because we are using this aromatase inhibitor in most frequently tamoxifen and letrozole they are used in breast cancer. And this is an additional finding that it will give follicular growth, just like Viagra. So it is a boon. So why there is a one sentence written theoretically that is aromatase inhibitor may be teratogenic.
Because of high androgen levels,
Yes.
it was assumed
But
that
nowadays letrozole is the first line of treatment in each and every case of unexplained infertility.
is still not labeled for
No, sir. Why I want to discuss this?
Offline in US, but no more offline in India. Yeah. So what my thinking of aromatase inhibitors is that it does increase androgen levels. But when we are giving letrozole in the first
Phase of follicular
cycle, and the follicular development starts after that. So if the androgens have a half-life of say 2 days, then by the time there is ovulation, the androgen levels really go down. By the time there is fertilization, the androgen levels go down. So ovulation does not take place in hyperandrogenic state. Fertilization also does not take place in hyperandrogenic state. So idea of teratogenic effect of androgen is gone.
Is what?
So I think the ban was totally missed. Okay.
And sir, we had done study of comparing clomiphene citrate and letrozole, and before 2 years I presented my poster in X-ray also. Indeed, we had proven that nowadays with letrozole, the pregnancy rate is monofollicular pregnancy rate is comparatively more compared to clomiphene citrate, and that's why now letrozole is acceptable, even though X-ray is also expecting that type of paper that now you are compared with clomiphene citrate with
So now
letrozole.
even non-PCO patient, letrozole is a preferred drug
Yeah.
over clomiphene.
So first time for now in PCO, recently I have published one review article in that we had written that PCOS first line of treatment is letrozole. We have to change from clomiphene citrate to letrozole.
There's only one thing that I want to tell you about letrozole once again. That letrozole produces very weak FSH levels.
Yeah.
So at times you may have to add gonadotropin from day 7 to get a proper follicle.
So if you are monitoring the follicle, you can add it.
So now now we have finished with the clomiphene,
Citrate.
and letrozole, and he wants to, or you want to start straight away gonadotropins. Does it really help in unexplained infertility?
Definitely, sir. But won't give it in the first cycle. Maybe I'll add in the second or third cycle of IUI. But it helps because it causes multiple.
Patient has already undergone CC cycle 2 with you, 2 letrozole cycle with Lupor, now she comes to you. So you directly jump to the gonadotropin. You don't have the facility of ART 2 level. You are doing only ART 1 level things, you are doing IUI, and now you have to stimulate your patient only with gonadotropin and go for IUI.
Oral ovulation plus gonadotropin.
No, with a specific question. Gonadotropin and IUI. Whether you agree or whether you disagree.
No, only gonadotropin is not advisable in IUI. Oral ovulation
Why?
plus gonadotropin.
Why? Some madam
Yeah,
is
the reason
very
because
patient wants to
they
say, I
have-
want to give so much of money, you give me 7, 10, 15 eggs.
But according to ART law, in level 1 clinic, the gonadotropin if we are using,
Yeah.
then there is no facility of ovum pickup because they are not level 2.
Hmm.
So either they have to counsel the patient for the referring to the level 2 at the same time if OHS or multifollicular development has
And that are the chances if with the use of gonadotropin.
Yes.
Cost plus we have to think of OHSS.
daily injection, OHSS and ART law.
And there is
OHSS
only
and the risk of multiple pregnancies.
Yes,
with only marginal increase in the success rate.
Hmm.
If we are doing with conventional dose gonadotropin throughout pure gonadotropin cycle, we increase the success rate by only few percent, and at the same time we are adding the risk, extra risk of multiple pregnancies.
So खर्चा ज़्यादा और पाया कुछ नहीं.
We use only letrozole followed by gonadotropin. So whenever you are using
No, madam. Letrozole, forget the letrozole.
Yes.
Forget the
in
letrozole.
IUI you are using gonadotropin.
Yeah.
Now, the specific question is,
Yes.
if your patient has already taken clomiphene, patient has already taken letrozole, now patient comes to you, would you like to give only gonadotropin and IUI? Yes or no?
No.
Madam Mukund,
Combined.
only gonadotropin and IUI. Even
No.
though you have got level 2 center.
Too big a risk to do in an IUI. There is no need to.
I think you are
Suppose
very,
with
very
level
right.
2, yes sir, level 2 center we can start IUI with gonadotropin, but with consent of converted into
Rescue IVF,
rescue IVF.
using all
Yes.
Rescue IVF is
so
a-
OHS.
It is a compromised IVF and a super
Yes.
expensive IUI. So I mean,
Because
it's
in
better
IUI we have
not to.
given low dose, so there is no much recruitment of M2.
Right.
So for audience, it should be fixed that gonadotropin IUI is not a good practice.
Yes.
We can say don't do it, but it is not a good recommended practice. Thank you. Thank you.
Do this. Okay? So these are two valuable suggestions. There is, and he rightly said, that putting a scope, pushing the blue dye from transcervical region and seeing the tumen, then coming out and writing on the board pizza patent. And that is the most ridiculous laparoscopy report we have seen, and we have seen it before. We have seen in our practice before that someone has scribbled board pizza patent in laparoscopy. Okay? So that has to be not done.
Particularly the cases of unexplained infertility, you have to treat the cause. And so at our hospital, at Ramabain Hospital at Manish IIT, we perform laparoscopy rather than gonadotropin IUI. Okay? The next treatment step should be the number of these women will have findings of endometritis, adjacent disease, and regardless of symptoms. Surgical treatment of endometriosis is associated with improved fertility rate, but does not increase the risk of multiple gestation. So after laparoscopy, another course of ovulation induction with ovulation inducing drugs. But if you are not satisfied, you can combine with clomiphen or letrozole, little amount of gonadotropin, and then you do IUI. So it is an alternative step before going to Banker IVF Center.
So, I think it's time to summarize.
This is last slide.
Can someone read it out?
Yes, madam.
We've been talking too much.
Yes, sir. The management of couples with
Madam, let her explain because she has not done anything. Because she is
You
just
can
behind
get up.
the.
You can get up. and-
You can get up and just read my concluding remarks from the madam.
The management of couples with unexplained infertility usually starts with treatments that consume few resources, are low risk, and are patient directed, that is, lifestyle changes, and then moves sequentially to treatments requiring proportionately greater resources and risks, like clomiphen or letrozole plus IUI, and finally to higher risk and high resource intensive interventions like IVF and laparoscopy. Ovarian oocyte pool declines rapidly for women over 37 years of age, inevitably causing ovarian aging and depletion. Thus, expectant and low-cost management is not recommended for these women. IVF may be offered early.
Great.
Thank you.
I
Thank
think
you
we had
very
a
much.
lovely, we had a lovely.
Thank you very much.